So now we need to get the lower teeth. In this case, our patient has natural teeth, so we will, of course, have to scan that intraorally. It's usually easier to scan the opposing without the denture in place. This gives you more room to maneuver. Just like scanning anything else, we will begin in the posterior and move towards the anterior. We need to capture our occlusal surfaces. We do need to capture some of the buccal aspect of these teeth to help with the bite registration, but it does not have to be perfect. It does not have to be exact. Anywhere there's a reflective surface, it's not going to want to immediately pick up. But again, we're keeping the wand moving at all times. We don't want to hover in one place very long, capturing the chewing surfaces of all of these teeth, moving around from left posterior through the anterior to the right posterior. We just about got it all. We've got the buccal surfaces very nicely. We will seat his upper denture to get our bite registration. So we're going to clean off our powder before we put it in the patient's mouth. And we will have the patient bite down all the way. And we will do our normal bite scan beginning in the posterior, working our way to the midline. So we'll have the patient close all the way nice and firmly, squeeze down, and we'll begin scanning in the posterior with sort of a rocking motion up and down, capturing the upper and the lower. We get to the midline, and we're good. We will stop. We will go to the posterior on the right side, slide it inside the cheek, continue on around from the midline to the posterior. It's good to get both sides of the occlusion. This helps our lab properly register the bite. If there's any interference on one side, they have it on the other side. Get a good accurate bite. So now we have our upper scan, we have our lower scan, we have our bite scan. This is ready to go to the lab and process a copy denture.